now I want to pass things off to Mary Story. Mary is a professor of community and family medicine and global health at Duke and is our associate director for academic programs. And Mary will present some awards and introduce our student speaker.
Thank you, David. And I join David and Mike in extending a warm welcome to all of you and a heartfelt congratulations to our global health graduates. As you know, Duke is a very special place, and the students, staff, and faculty here are just outstanding. That's why selecting today's award winners was especially challenging. Today I will present 2 awards. One to the student team with the most outstanding Capstone research project, and the other award for the winner of the Distinguished Teaching Award for DGHI's undergraduate program. First, we'll recognize the students. All of our global health majors must take a senior Capstone seminar where they create a Capstone research project that represents the culmination of their studies in global health. Students work in small teams to research a global health problem, consult with experts in the field, community members, and they design and develop a feasible, impactful solution to that program. This exercise is designed to help them understand the value of teamwork and the intricacies of working in global health, realizing there are many players and many factors involved. Each year, we recognize an outstanding Capstone project and team members. I'll first describe this year's winning project and then invite the team members to come to the stage to receive the award. Obesity is a pressing issue in communities across the United States and globally. And poor nutrition is one of the primary drivers of the obesity epidemic. Here in Durham and elsewhere in the U.S., the Latino community is disproportionately affected by obesity due to several factors, such as lack of access to healthy foods, targeted advertising and marketing of unhealthy foods, and the high cost of healthy foods, including fruits and vegetables. This year's winning Capstone project addresses these issues through an intervention in partnership with community churches. This project works with Durham's Latino church community to increase awareness about healthy eating and also increase household access to healthy foods through a food truck. The pilot intervention will take place with La Iglesia Emmanuel, a large Latino church in Durham. After the initial pilot phase, the project seeks to establish a sustainable program that could be upscaled in other regions throughout the United States. I think this work represents a community-based, practical approach to addressing the issue of obesity and also increasing healthy food access. Please join me in congratulating the winning team of 5 global health majors. And if you could, when I call your name, if you could come up, Natalie Lubin, and Virginie Marchand, Christina Schmidt, and Amy Lansdale, and Andrew Wong. And Dennis Clements, who was the professor in the class. If you would join together, and you'll have your picture taken. And at the end of the semester, all of the students do poster sessions so they can share with faculty and other students their projects. Moving on, I have the distinct pleasure to recognize a valued colleague with this year's award for Outstanding Undergraduate Program Professor. This year's winner is a perennial student favorite, and his many engaging, zany, and memorable and effective teaching techniques are part of the DGHI lore. Of course, I'm talking about Dr. David Boyd. I'll read you some of the nominations that we received, just so that you can get a sense of the impact he's had on students. Words don't do justice to the profound impact Dr. Boyd has had on me and many of my peers during my time at Duke. His engaging teaching style is what convinced me to become a global health major 3 years ago, and he's been an incredible mentor and role model ever since. David Boyd's passion for teaching solidified my decision to continue studying global health. He's provided me with invaluable mentorship and advice, and I'll always remember the lessons he's taught me. And finally, Dr. Boyd was the best introduction to global health I could possibly have had. His passion and enthusiasm for the subject was infectious, and he engaged and fostered my interest through interactive activities, interesting case studies, and having his door open to us for questions and advice whenever we needed it. David Boyd's office is about 3 doors down from mine, and there's always a line of students waiting, and his arms are always open. Dr. Boyd could not be here to join us. He was planning on it, and there's a student that he's trying to help that just left for Guatemala, and so he's really tied up for that, but I know that he really wanted to be here today. So please join me in at least applauding Dr. Boyd. And now I'm delighted to introduce this year's student commencement speaker, and she is Sofia Caballero Stafford. Sophia sets a powerful example for all of us, even at her relatively young age. She was selected to be an Alice Baldwin Scholar, which inspires and supports undergraduate women to become engaged and confident leaders in the Duke community and beyond. Sophia is the Southeast regional lead for Girl Up, where she was previously a teen advisor. At Duke, she founded the Girls Hub Leadership Development Program for high school students and is a columnist for the Duke Chronicle. In 2015, she lived and studied global health, race, and human rights in Brazil. She was also a summer intern for USAID, working on the Saving Lives at Birth initiative. She's a dual major in global health and cultural anthropology, and she has a deep interest in the empowerment of women and girls, and you'll be hearing from her today. Please join me in welcoming Sofia Caballero Stafford.
Thank you very much, Dr. Story. I'm delighted to be here today to talk about our journey as leaders on this day and this weekend when some things are ending, but so much more is just beginning. As a teenager, I was exposed to stories of girls who were seemingly just like me. Girls whose eyes widened with curiosity as they learned new things, who loved adventure and spending time with friends, and who were full of hopes and dreams for their future. Yet, I learned that while we shared that zest for life, our actual lives were radically different from one another. While I was sitting at my desk in school, freshly sharpened pencils in my hand, and clean water a push of a button away, in places like Guatemala and Malawi, girls just like me were beginning their 6-hour journey to collect water for their families. Little did I know it at the time, but this disturbing realization signaled the beginning of my journey to leadership through global health. My senior year in high school, I had the opportunity to visit Guatemala with the United Nations program called Girl Up that works to address the lack of access to education and health services for adolescents and to end violence against girls and women. My time in Guatemala was transformative. I met Rosa, who had always wanted to become a teacher. She imagined herself standing in front of a blackboard surrounded by girls. She told me, "I want girls not only to dream, but to achieve their goals. To do so, they must study, know their rights, and learn how to plan." That dream was shattered after Rosa got pregnant. She was only 14 years old. I also met Vilma, who lives in a small town in the western highlands of Guatemala. She drew me the picture behind me and told me that it represented how she felt before being allowed to attend programs supported by Girl Up. After learning to read and getting information about her rights, she said it was as if the blindfold had been removed, and now she understands the power she has to be a leader in her community. I was witnessing the girl effect in action. When given the opportunity, the girls I met in Guatemala were lifting themselves and their families out of poverty, creating ripple effects across their communities and countries. I sat on the plane ride back, shedding tears of anger and sadness about the circumstances of the girls I had come to know, and because of the immense responsibility I felt to girls like Rosa and Vilma. What I have come to realize, though, through working with and getting to know all of you, and through our experiences in global health at Duke, is that it wasn't a feeling of guilt or obligation that set me on this course. It was a deep sense of purpose driven by injustice. This purpose is my motivation for what I chose to study at Duke. My passion for girls' and women's rights is what gets me out of the bed in the morning. It's what puts things in perspective. It's my biggest challenge and my biggest energizer. My question then, as it continues to be now, is what are the tools that girls need to empower themselves and overcome the barriers that stand in their way of their dreams? We all have different questions that energize us about the field of global health. How can we use spatial mapping to identify and reduce HIV risk behaviors in Western Kenya? How can we improve the health of people in Robeson County, North Carolina, an area with the highest rate of kidney failure in the country? How do we give women the access and tools they need to be in control of their own reproductive health, whether in Durham or rural Uganda? How do we effectively address the mental health burden in low-resource settings at the community level? These are some of the questions that have guided us during our summer projects with SRTs and Fast Connections, and that continue to guide us as we prepare to take our next leap. Like many of you, I came into global health at Duke because of a passion or desire to serve, to address health disparities, to alleviate health inequities, to lift others out of poverty. Together, we took on the challenges of Global Health 101, learning that first and foremost, teamwork would be the foundation for many of our global health courses and successes. And let's admit it, even though in the beginning we were pretty skeptical about the idea of never-ending team projects, we came to find that working with a group of dedicated, passionate people who each brought their own strengths to the team was a game changer. With funky hats and intense tweet-outs in Dr. Boyd's class, we learned the foundations of global health. Dr. Yeli and Dr. Green fearlessly led the way for us to better understand and apply research study designs in our methods course. Dr. Yami taught us about the process of policy development using the policy triangle, which no one is likely to forget anytime soon. All of these courses helped us to better comprehend the world of global health, a field that in the years to come would bring us equal doses of frustration, sadness, and confusion, followed by moments of pure joy and fulfillment. Whether it was in the slums of India, at a girls' school in Kenya, or working with domestic violence survivors in our own backyard, our experiences in and outside the classroom have shaped the vision we have for ourselves, our communities, and our world. We are all graduating today with our own approaches to tackling global health problems. Some of us will go on to be doctors, nurses, lawyers, work at nonprofits, in policy or government or business. Others will go on to be researchers, professors, or entrepreneurs. We all have our own calling card within the field and our own lenses with which to examine it. But no matter how different our paths to global health have been, one thing is for sure. The classes, experiences, and mentors have prepared us to be leaders, to know when to act and when not to act boldly and humbly, and not to be afraid of failure. I will share 3 of these lessons that, at least for me, have been the biggest lessons in leadership, and I hope will resonate with you all as well. The first lesson I believe global health has taught us is how to be truly empathetic by being with. In the classroom or in the field, our ability to be empathetic is not just being able to put ourselves in the shoes of others, to be open-minded, and to understand. Empathizing has helped us to truly and deeply feel another's pain, and to know that sometimes we have to make decisions that are right and hard, instead of choosing not to act because it's too hard. Being an effective leader requires an ability to listen, and to listen well. Through our global health classes and experiences, we have been challenged to seek to be with. For me, being with allows me to engage with the world in a way that is much different than working for. Being with empowers me to give and to receive in order to create strong relationships and facilitate the growth of community. It means stepping into someone else's shoes and truly seeing, but not attempting to know, another's lived experience. It is trading assumptions for an open mind and an open heart. One of the first things we learn in our global health classes is to ask and listen before we assume and tackle, regardless of how good our intentions might be. Being with means engaging vulnerably, passionately, and deeply. Through this mindset, we can stop searching for the similarities between ourselves and others for that comfortable commonality to spark a relationship, and instead embrace the differences. In the process, we can create relationships that are genuinely mutual and ones that will continue to grow and evolve. Becoming part of the communities better equips us to help strengthen them. Being with is not always easy or comfortable, but it gives us a sense of purpose. It is in those moments of discomfort, surrounded by community, that we are learning to be our best selves and grow as leaders with a profound sense of responsibility. The second lesson in leadership that global health has taught me is to fail fast and to fail often. Yes, I said fail. We come to Duke programmed to be risk-averse, to avoid failing at all costs because the consequences seem too big. But in global health, failure isn't just inevitable. It's necessary. We witness this in the case studies we've examined and in our fieldwork or internships. Global health work is iterative. A solution or intervention might work really well in one community in rural Kenya, but not work at all in urban Kenya. So we need to be able to go back to the drawing board, to learn, culturally adapt, and try again. What's important is not the failure, but how we react to that failure, what we learn from it, and how we move forward. We can choose to let the failure knock us down and keep us down, or we can choose to stand back up and try again. In designing and implementing projects during our summer experiences, or even in the classroom, many of us have, I surely have, failed in one way or another. Whether we didn't ask enough questions of our community partner, we didn't understand the system well enough, or whether we moved too quickly or too slowly, global health is a field in which we must be willing to take risks and set our goals high enough that we might end up defeated. Failing fast and failing often teaches us resilience. Learning to take a different approach, to fix a mistake, and to do better next time are all important skills, not only for the field of global health, but for leadership and for life. DJHI has given us the foundation to be confident in our abilities to be agents of change that allow us to be open to failure and to persevere in order to address some of the world's biggest problems. The final lesson that I will share with you all today is one of humility. Being a global health major at Duke has humbled me in more ways than I will ever be able to describe, but I will say this. With the immense opportunities we have had at Duke, within and beyond the borders of this campus, to pursue our passions and personal best, to see and engage with the world around us, and to be able to work with people in their most vulnerable times, we must recognize that the field of global health is one of privilege. when we travel to rural communities off the coast of Honduras for our SRT program, or to small villages in Uganda, or even from our desks in DC, we have the choice, the freedom to do so. It is our work and it is our passion, but it is not our reality, and as such, it is our privilege. We must continue to recognize the privilege we have to be able to work in this field, to be invited into communities, to amplify the voices of others when policymakers and funders are not listening. We have the privilege of having our feet on the ground and a seat at the table because we have the skills and experiences and the mentorship and guidance from people in this room to be able to do that. Finally, I am humbled by all of you. To my global health professors and mentor, Dr. Puffer, who care deeply about lifting up the next generation of leaders. You are always willing to go that extra mile in and outside the classroom. You have given us the tools to and opened doors of opportunity for us to grow as learners and leaders. I have as much gratitude and admiration for you all, my friends and colleagues, as I have for my professors and mentors at DJHI. Working with you all on projects, competitions, classes has made me a more effective follower and a stronger leader. I am inspired and energized every day by the impact that you have had and will continue to have in your careers. As we move on to our next chapters, whatever and wherever they may be, I would like to urge us all not to lose the capacity to be shocked by injustice in the world, perhaps the one that first inspired our questions, to ask ourselves every day what duty we have to create the enduring conditions in which all people are healthy and safe, and to lean on the people sitting in this room to help us do that. Global health has taught us the value of living a life of consequence, knowing that our actions, whether positive or negative, intentional or unintentional, impact the lives of others. We seek to achieve, not for achievement's sake alone, but rather because we are discovering how our achievements might help to make the world better than we found it. These are lessons in leadership that we will carry with us as we begin to carve our paths. I cannot wait to see what you all accomplish next. Thank you.